And certainly mental health is a big part of that, with social distancing and all the activities that we've had to put a pause on, and the time that we've had to spend apart, and the many concerns and worries that come with this pandemic that none of us, most of us, have ever lived through in our lives. So certainly mental health is something that many of us are struggling with. And so what I want to begin with when I welcome you here this evening is just a note to remind you that you're not alone. And if you came here this evening to get help for yourself or perhaps for somebody that you care about, please remember that you're not alone. Your concerns matter, your questions matter, and are likely shared by many, many people. So thank you again for being here. It's our tradition at Sharp Healthcare to begin every gathering, and we're not having a lot of in-person gatherings, but still virtual gatherings, with a reflection. Our reflection this evening is "Let perseverance be your engine and hope be your fuel." And that's by H. Jackson Brown Jr., who's an American author. And that reflection is certainly relevant to this time that we're living in. This evening's presentations will begin shortly. We'll have an update on COVID-19. We are planning on having Dr. Andre Smith with us, but he was having some technical difficulties with his computer, so he's working through those, and we hope that he'll be able to join us later. But we'll have Dr. Leticia Polanco giving an update on health and wellness in a pandemic, and also giving an update on COVID-19. And we have Dr. Joseph Minnick, who will talk about seeking mental health support. We're glad to offer a Q&A session tonight. We're sure that you have many questions, and we are excited about the opportunity to hope we give you some answers. A couple of reminders I want to share with everyone. All of you but us, the speakers, are muted. You should see two boxes on your screen. One is a chat box. Feel free to use that to type any comments you have as you hear the physicians speaking. If there's anything that you want to share, feel free to share that in the chat box. You should also see a Q&A box, and that's where you can submit questions. Feel free to submit questions anytime during the presentation, and they will be answered at the end. And if your question is for a specific physician, please note that so we can direct your question to that physician. Our speakers this evening are hopefully Dr. Andre Smith. He's the Medical Director of Emergency Medicine here at Sharp Chula Vista Medical Center, and he's also the Medical Director of International Patient Services for Sharp Healthcare. Dr. Leticia Polanco is a family medicine physician with South Bay Primary Medical Group, and she's also affiliated with Sharp Chula Vista. And we have Dr. Joseph Minnick, who's the Medical Director of the Spanish Cognitive Behavioral Therapy Program at Sharp Mesa Vista Hospital. Without further ado, I want to turn it over to, I believe, Dr. Leticia Polanco, who will start us out this evening, giving an update on COVID-19.
Good evening, everyone. Can you hear me? So as we're living this COVID pandemic, right, and we have this wonderful webinar planned out for you, we have a dynamic speaker, Dr. Smith, and I can see Dr. Smith, but I'm not sure if he's ready. Are you ready, Dr. Smith?
I think I am. Hopefully
I can hear you.
To be seen as well, but I am here.
I can see you beautifully. You look fantastic. So welcome, and I'm glad, technical difficulties occur for all of us during this time, and we all remain very flexible, and I'm just so glad that you were able to join us. So
thank you.
Thank you.
So with that, Leticia, if you want to continue, and then I'll start after you.
No, you're good. You're good because we haven't started yet. Yeah, so we would just need our slides up, Laura, please.
Well, thank you all for joining us tonight, and it's a very exciting evening. And yes, unfortunately, we are going through very challenging times. And what I wanted to do is do a summary of what has happened in the last couple of months. And definitely, I mean, we are in a pandemic, and we're still going through the different phases. So what I wanted to explain is, what is it that we're seeing here in San Diego, in South Bay, and also with our fellow neighbors of Baja. What I wanted to do is just capture some general information of what we have been seeing. So Laura, any chance you could be able to start with a with these slides? It's simple slides, but I think it kind of gives you an idea.
I'm sorry, Dr. Smith. I thought I was presenting. Give me one moment.
Okay.
Okay.
There we go.
There we go.
Okay, so if you can go follow the next one, please. Great. So if you can go back to the previous picture, because I think it does tell you in essence what's happening. This is a Mexican, this is basically the San Diego-Tijuana border, and it's the busiest border of the world. It's about 100,000 cars, actually, between 60 to 100,000 cars cross every day this border. And one of the things that I can tell you about this, which is very unique, is it's the same situation. San Diego and Tijuana are connected. So the border of the US with Mexico is very interconnected. And the reason that I'm saying this is because that's what we see with infectious diseases. I'll give you an example, like the swine flu, tuberculosis, meningitis, as well as other diseases that we've seen, and now it's COVID-19. And what I would say is usually what we've seen is whatever happens in one city, it happens on the other side of the city in another country. So what's interestingly enough is what we saw is actually that the pandemic started, in this case, in the city of San Diego initially. And then from there, 2 weeks later, we noticed that the cases of COVID started to appear in Tijuana. So it was very interesting to kind of see that pattern. Again, we just don't know what happened, why this occurred in one place and then the other one, we noticed that spike of cases, but it's something that we've noticed. So from there, let's move to the other slide. So late March, beginning of April, all of a sudden we started seeing these cases that we knew that were coming, because basically it started in the East Coast as well as up north, California, especially in the northern states above California. That's what we noticed, that there were cases that started to appear. So what we did as a hospital system is that we started to plan ahead to see how we could be able to manage the concern that we had that we were going to have a lot of cases, a lot of people very ill, and not enough hospital beds. So as time went by, what we saw is that the people that were getting sick, that required to be in the hospital, were usually people that were 50 years or older. And the ones that we noticed that were requiring to be admitted and that were very sick were people that had medical issues like diabetes, hypertension, morbid obesity. And what we saw is about 30% of the cases that were coming to the ER or to the hospital, a third required to be admitted to this facility and to all the hospitals in San Diego. So that was basically what we saw. Now, what has occurred now? Now we're seeing a trend where it's more of a younger population that are getting exposed and infected and have been coming to the hospital. But the only thing what's been interesting is they come in, we see them, we evaluate them, and we do a test, and they're positive. But the majority of the time, they do not require to be admitted to the hospital. The mortality in this population is very, very small. About 9% of the cases required to be admitted to the hospital of the younger people, and about 30% of the people that are in the 50-year range or above. Next slide. So this is what we see if we look at the different entities or the different cities around us. You can see that up to now in San Diego, actually, I'm going to start from the world. You can see the numbers there. This is a couple of days old, but you can see what's happening around the world, how many cases we've had. Then from there, we can move to the US, and you can see the amount of cases that are there. As we move to California, you can see that the amount of cases that we had, it's about almost 700,000 cases. And you can see the amount of deaths or the mortality that we had in California. Then we moved to San Diego, and you can see that we've had about 37,000 cases in San Diego. And the majority are recovering. You can see that it's been about 21,000. The mortality, okay, it's about 1.8%, less than 2%. So the risk of dying from COVID is small.
Looks like we lost your audio, Dr. Smith.
Yes, can you hear me?
Yes.
Great. Okay, so again, the mortality is very small in San Diego, which is very, very important, I think, for people to be aware. It's about 1.8%. As we move to the border, as we move to Tijuana, you've seen that the positive cases is very small for Tijuana. And the question is why? Very simple. They're doing less testing than we are here in San Diego. As you can see, the mortality is double of what we've seen in San Diego. And I can tell you that probably it's multifactorial. One is that I think basically they had a challenge to be able to take care of their community. They tried to be prepared as much as they could, but it was a challenge. Now, as we move to the Imperial County, which is very important because that was in the news for a while, is you can see that the cases were not very high, but there's only 2 hospitals, and they're very small hospitals for the amount of cases that they were seeing. So unfortunately, they were impacted just because they did not have the infrastructure. And you can see the mortality. Actually, mortality, unfortunately, was very high. So from Imperial County, which is El Centro, California, and Calexico, they have to transfer patients all the way to Santa Barbara, if not even to Las Vegas, as well as other cities, to move these patients because there was not enough hospital beds to take care of them. Next one, next slide, please. Okay, so how are we doing in the hospital? Overall, now we've seen a decrease. Slowly, we've seen a decrease in the amount of cases that we're seeing in the ER. It's about 20%. If you look at the hospital right now, the COVID cases, it's about 20% of all the admissions that we have in the hospital. So it's not a big number, but significant. Of the people that get admitted to the hospital with COVID disease, the majority, again, around the average is about 50 years old and above. The only thing that I want to mention with this is usually these cases or these patients end up getting sick to the point where they're required to be admitted to the intensive care unit, which is about a half of them. Of the people that are in the ICU, about half need to be in a ventilator for support. And the mortality is a little high, and you can see that, unfortunately. It is, unfortunately, it's despite of all the things that we've been doing and all the technology, still the technology is high. And actually, we've been doing better than, it's about 65%, okay? At the moment, the ICUs are almost at full capacity, which they're about 90%. And the reason is because when people have this illness, they stay in the hospital for a long period of time. It could be up to 8 weeks. And these people end up staying in the ICU for a long period of time. Again, of all the things that I've said, one thing that I want you to leave with, yes, it's a very challenging disease and it's very dangerous, but the mortality is low. It's only 1.8% in San Diego. If you look in the world, it could be up to 8%. But in San Diego, I think we've been able to learn how to deal with this disease. And like I said, it's only about 2%, less than 2%, which is very important. Next slide. Okay, so coming back to Baja, there's been a decrease in the amount of cases, which is, I think, is very important. Yes, the mortality, unfortunately, like I said before, is very high in Mexico. It's about 85%. In Ensenada, we do know, I don't know a lot of the statistics, but I can tell you that it's probably related or similar to Tijuana. Mexicali, Slowly, the cases are coming down, so now things are more stable. Still, the mortality is about 65%. Next slide. Uh, One thing that I wanted to share with you, which I think is that I can tell you that I'm very proud of as a San Diego physician. We were asked by the Secretary of Health of Baja we got a letter asking for help. Immediately, the San Diego physician community and the nursing community decided to participate and help and collaborate with them. So for 1 month, every day, a group of doctors and nurses from Sharp as well as other hospitals were going to Tijuana and Mexicali. For Tijuana, we did it for about a month, every day, where we participating on seeing the critical or the sicker patients that were on ventilators with COVID disease. And these were intensive care doctors, which are super specialists with experience in this disease, and also nurses. Also, we collaborated with the education of how to deal with this as well. So we did that in Tijuana and in Mexicali. Currently, we are doing telemedicine once a week where we review with Mexican doctors the sicker patients with COVID disease, and we collaborate, we work with them, we learn from them, and then they learn from us as well. So very exciting to see that the San Diego medical community reacted on this to help our fellow neighbors. Next one. Okay, so just to move along. So I think that I wanted to kind of go over some questions. It's usually they're common. And basically the question that comes up is, what if I'm exposed? Or what if someone from my house is exposed? What do we do? Okay, very simple. Obviously, first, if you're exposed, the recommendation up to now is still that you need to be tested, whether it's through your primary doctor, an urgent care, a community clinic, or the hospital, in this case, the ER. We're always available 24/7 to take care of you here in the hospital. So if that happens, while you wait for the results, okay, and things are getting better where it's less days than before in terms of getting the results, while you wait, you should consider yourself as being at high risk for COVID, even if you don't have any symptoms. So what you need to do is a couple of things that are very simple. Wear a mask all the time. Social distancing, and you've heard about the 6 feet social distancing, which is very important. The third one is wash your hands, very important. So what do you do at home if someone, either you or someone in your house has been exposed? Try to isolate yourself as much as possible. Don't share your food. Again, it's very important you try to isolate yourself as much as you can. Okay, next slide. Okay, so what happens if I'm positive? Or what happens if someone in my house is positive? The recommendation is the same thing that I mentioned before. Social mask, and also it's very important that you wash your hands. But also, if you can, you should try to isolate a little bit more if you can in a private room. It's very important. And again, that's the essence of what we do in the hospital. And this is the same thing that I would recommend you to do at the house. Now, when is it that you're not contagious? Usually it's after 10 days from having symptoms. So from the time that you started with the symptoms, once the symptoms starts going away, usually 10 days later, that means that you don't have, basically the virus is not in your body. So at that point, you're not contagious anymore. Next slide. Okay, treatments. And what is it that you hear in the news? Yeah, there's a lot of stuff going on in the news that sometimes is very confusing. And you probably heard, although it's a little bit, this is kind of outdated, but still I think it's very important because there was a lot of people that were very confused about these medications like hydroxychloroquine. It was kind of going back and forth. At the moment, what we found is, it probably doesn't help. And yes, it has a lot of side effects that could be very dangerous. Therefore, we're not using them in the hospital anymore. The reason that I have this about the Mexican pharmacies is because there was a point in time that, and still where you see that in some countries, like in Mexico, if you go to the pharmacy, they will sell you a COVID-19 kit, which is basically hydroxychloroquine with antibiotics and as well as other medications that unfortunately have not been proven to help at all. So please just be careful. Now, there is a medication that's called remdesivir that we are doing trials in the hospital. So if someone gets admitted, you might be a candidate for this antibiotic, basically for this medication. And we have seen that people get better, especially if you're treated early on from the illness. So that's why it's very important. If you feel that you're getting sick and you feel that you're at risk, you need to be evaluated as soon as possible. Okay. Vaccinations, I think we have heard a lot, and yes, they're coming. And I can tell you, for example, here in San Diego, we were lucky enough that we were able to get a total of 300 vaccines as a trial basis. And we are at a phase where it was been distributed throughout the city for testing. And luckily enough, here, for example, at Sharp in Chula Vista, we had a trial of 30 vaccines that were given to multiple people in the community, including doctors and nurses. So that's what's coming, and that's what I think is going to make us be able to get through this situation in this pandemic. So with that, I'm going to finish, and I want to just basically tell you all, just please be safe, follow the recommendations that I mentioned. Again, not very complicated, but it certainly can make a difference. So thank you to all.
Thank you so much, Dr. Smith, for that important update and all that important information. Before I welcome Dr. Polanco, we want to take a poll. You know, we're all here together. We're talking about mental health. We're talking about COVID-19. And so we want to pose a question to all of you at home in the audience. Tell us how you're feeling tonight. Check in and tell it, you know, think about kind of how you're feeling and what brings you here and let us know how you're feeling. And that'll certainly be relevant as we hear more from Dr. Polanco and Dr. Minnick. With that, I would like to welcome Dr. Leticia Polanco.
Good evening, everyone. My name is Dr. Leticia Polanco, and I am a family physician that has been practicing in the Chula Vista area for about 20 years. I've been affiliated with Sharp Chula Vista. I am from San Diego, and I am very blessed to have a practice that I share with my husband here at the Sharp Chula Vista Medical Center. It's South Bay Primary Medical Group. We are both very active, both in the community and with our children. We have 4 daughters that we are trying to juggle and hopefully make and guide to become good community members and leaders. So that's quite a big task. But I thank you today for joining us, because I know that this topic is so unique and so needed during this time, because the pandemic, the coronavirus pandemic, has really kind of changed all of our lives globally. So with that, Laura, could you advance the slide for me? Thank you. So the COVID impact on health, and again, this is a topic that that we're all discussing, and we're talking about the lives, the way that our lives have changed. We were all advised, and I remember the day exactly, March 16th, the stay-at-home orders were in place, and people around the world started to make these changes that we all thought were going to be maybe 2 weeks, 14 days, and everything will go back to normal. And now we're, 5 months into this, and we're still struggling with the changes that are in place and the news and all the information that's out in the media. It's affected our lifestyle, the way that we live, and the way we get our health care. So what do I mean by that? Everything, it used to be that you get in your car, you go to the grocery store, you go with your kids, you pick up your groceries, you bring them home. It really was, at least it was a chore, but it wasn't so considered as difficult, right? where now you have to wear a mask, you're social distance, you're wiping everything down, you're really selective, you're not touching everything as much. If you're a tactile person, that's really, really causing a little bit of stress because you're not able to look at the produce like you used to before and touch it and feel it and take it home with you. So little things like that for some may not be that important, cause a tremendous amount of stress in others. And our healthcare is the same way, right? We've done so many wonderful things to increase the access to our patients by not only increasing office hours, but by providing video and phone calls to patients as well as in-office visits. But it's hard to assume that you're getting, some people are still having to integrate that as part of their healthcare. Yet we see more communication between our patients, and we feel that we are providing quality care, not only with primary care doctors, but also, with your physician specialist. So what have we seen during this time? We've seen some people that have really embraced this time and said, I'm going to watch what I eat. I'm cooking at home a little bit more, and I'm, spending more quality time and family time. And then there's, been a lot of us that have had less activity because we can't go to the gym. We can't go outside, perhaps to a restaurant that we may have wanted to visit, or out with a group of friends to exercise or for a Zumba class. Maybe some poor eating habits or a little bit more consumption of alcohol, less focus on my everyday health. And of course, I'm going to forget to go and get my mammogram or schedule my colonoscopy, because the truth is I'm hearing all these things on the news about how the coronavirus is out there, and is it really safe to go and visit my primary and get these procedures done? So it's caused a little bit of, some changes emotionally, and as a result, some limitation to access, or even some fear. So next slide, Laura, please. So conditions such as blood pressure, diabetes, asthma, those need to be managed regularly, not just by patients, but also, especially by primaries like myself. We definitely need to check in with you, make sure that your refills are up to date, make sure that your medications, with the changes perhaps in your health and your activity, your blood pressure may have gone up, your blood sugar may have gone up or down. And so we need to make those necessary adjustments. So when we're not getting in touch with you, or we're not making that connection, those types of conditions can lead to other more serious ones if not taken, if not controlled. So, sometimes appointments or commitments get postponed or canceled, but they shouldn't be. Please know that these, although we may not be able to see you in the office, we can definitely reach all of your providers. I can probably speak for all of my sharp primary care physicians that please reach out to us, talk to us, let us know what your situations are. In many cases, you may be out of work, you may not be able to go get a prescription, but nowadays there are so many things, so many services available to you. Next slide, Laura. So again, the impact of COVID on mental health, as I mentioned before, it's caused some anxiety in some people, perhaps even some fear. So we are seeing people with increased worry, sadness, despondency. You're not sleeping as well, or sleep is excessive, loneliness, hopelessness, helplessness, anger, frustration, irritability, racing thoughts and looping thoughts. I've had some people that just, putting the mask on just causes a lot of anger and racing thoughts that they can only have it on for a very short period of time, and then they have to go into their car or a place of refuge or even outside where they can get some air. Please, we advise you to not only be on the lookout for yourself, but your family members, for suicidal thoughts, gestures, attempts changes in habits, the things that they don't do on a regular basis, and really encourage them to get some help because we are here for that. Next slide, Ms. Laura. So the importance of having a primary care physician. Maybe I'm biased, but I think that as a primary care physician, we can definitely assist our patients in so many things. We are here to really be the co-captains of your healthcare because you, at the end of the day, are the captain. We are here to assist you. We're the first line in many cases for the defense of any illness or complaint, including mental health concerns. So when you're not feeling well and you really just don't know the why, we are here to help you try to figure that out and try to compose a treatment plan that we can all oblige to and try to follow with taking into consideration all the resources that you have available to you, not only through your health insurance, but also through Sharp Healthcare. So your safety is our utmost concern, and it's never been safer to access healthcare during this time. I hear it a lot. I'm afraid to go to the emergency room, doctor. I'm afraid to go to your office. Please know we take all of the precautions necessary to keep you safe during this time. Let that not be a deterrent for care. As primary care physicians, we are able to treat depression and anxiety. We are able to treat substance abuse and mood disorders. And also, very importantly, we are there to assist you, to guide you to find the right specialist for your needs. And know that, again, there's a lot of primary care physicians within our network. If you do not have one, visit sharp.com or call 1-800-82-SHARP, establish with a PCP, and really create that relationship and start getting some assistance and help. And with that, I thank you so much for your time, and I welcome, and I'm so blessed to have Dr. Minnick here with us today.
Thank you so much, Dr. Polanco. Such an important reminder to take care of our health throughout this pandemic, and certainly to come in and receive the care that you need it. Thanks to everyone who participated in the poll. I believe we're projecting the results of the poll right now. What I thought was interesting and makes a lot of sense is that more than half of us feel good, which is good, to just okay. And that just makes complete sense. We are living in a pandemic. We are living in difficult times, as both Dr. Smith and Dr. Polanco said. We are so fortunate to be joined this evening by somebody who really specializes in that exactly, and that's Dr. Joseph Minnick. So with that, let me advance the slide and welcome Dr. Joseph Minnick.
Thank you very much, Laura. And I'd like to start out by thanking both Dr. Smith and Polanco for that very lucid and articulate presentation on both of their parts. I've been a psychiatrist in San Diego for about 30 years, and all 30 of those years have been in some way affiliated with Mesa Vista Hospital. I'm from San Diego. I grew up here. So it gives me the added advantage of having that perspective of how things have changed in our community. Can we go to the first slide so that we can start talking about this very important issue, Laura? One of the most important things that Dr. Polanco touched on is not delaying in reaching out and getting help. One of the things that we've noticed here at the hospital is even with our outpatient population, that is those individuals who do not have to be admitted as inpatients, is how this can slowly come up on you. The frustration, the anxiety, the insomnia gradually have a tendency to build up. And it's important to not let it get the better of you. One of the things that we've correlated it to is the exposure. We become masters of media presentation. And as a result, 24/7, you have available the latest news on where this pandemic has taken us. And some individuals, either through anxiety or through true interest, find themselves glued to their television set, or even driving home from work or from other errands or tasks, listening to the radio. And that serves to provoke more anxiety, more frustration. And what we're advising our patients is to try to limit themselves to the exposure of just one newscast per day so that they can be informed but not inundated by what's happening. When you start to feel that you're not as efficient as you were, you're not performing the usual tasks, you're not maybe as up on your grooming or hygiene, or you're a little bit later in getting out of bed, maybe that's a time to reach out to your primary care doctor and use them as a primary portal just to check in and make sure. They know you medically better than anyone else. The effects of the pandemic have been seen in all aspects of our daily interactions in terms of how we relate with our fellow workers, family, and social relationships. So again, I can't emphasize enough how important it is to seek out help, or if for no other reason than to sound out your primary care provider in terms of how you're doing, and just relay your feelings. It may be an appropriate reaction. It may be that perhaps we need to talk to someone. That's the place to start out. Can we have the next slide, Laura? There are a lot of treatment options, and they vary from education, which is very important and can't be emphasized enough. A lot of the misinformation that's out there coming from our government, our media, and even well-intended individuals who are propagating certain treatments that have no basis in scientific fact need to be dispelled. And the best way to do that, of course, is to check in with someone you trust, usually your primary care doctor, or other members of your community that you feel comfortable with. Support is essential, and it can be as near as someone you know and trust, whether it's your clergy, your neighbor, but most importantly, somebody who is educated and can keep you informed of what you need to do to take care of yourself and to take care of those that you love and care about. If you check in with your primary care doctor and they feel that maybe a little bit more attention is needed, their first step is probably to direct you to someone that can provide psychotherapeutic support. And this can range anywhere from supportive psychotherapy to listen to what some of your concerns are, what some of the frustrations have been in trying to carry out your basic everyday activities, to perhaps more insight-oriented psychotherapy in terms of determining where some of this is coming from. One of the things that we've discovered in working with some of our patients who have become adversely affected by the pandemic is discovering the effect that it's had on therapeutic issues that individuals have been able to keep occluded, or that they've been able to sublimate in some way, either in a healthy manner or not so healthy. And as a result, issues such as existential issues or issues dealing with family, divorce issues, or problems with their children, all of a sudden surge to the forefront and become important. And especially if you're either working from home, or if for other reasons you're not going to work or to school, it provides an unhealthy opportunity for ruminative thought. And what I mean by that is you find yourself at home, not much to do. You've seen all of the Gilligan Island reruns that you're interested in. And as a result, you find yourself locked into this pattern of thinking. And if we don't go beyond what we know, it's easy to talk ourselves into something negative that might get us in trouble. And finally, what a lot of people are concerned about, medication. It's frequently not necessary, and I'll go so far as to say that most of the time it's not necessary. When it is necessary, very light touches can be used initially by your primary care physician, and they're very adept at dealing with issues of anxiety, insomnia, primarily with non-medication techniques, such as behavioral techniques and cognitive techniques. But if necessary, they can use light and temporary measures to help you get through this pandemic. Next slide, please. What about resources? If your primary care physician feels that maybe we need to go a little bit farther for whatever reason, and you've already dealt with your primary care doctor as a first stop, and you can't get a hold of someone either because of office hours or holiday, such as the upcoming Memorial Day holiday or Labor Day holiday, excuse me, then, as Dr. Smith suggested, contact the ER. They're very helpful. They're always there to take care of us. But it might be a good idea to call first to see if they might not be able to help you over the phone and maybe save you a visit, or perhaps try to alert you as to the best time to be able to call the ER, or perhaps redirect you to urgent care if that might be more appropriate. And finally, you can call us directly here at 1-800-82-SHARP. And we have a myriad of programs here at the hospital. Most of them are outpatient programs, such as our cognitive therapy program, which meets from 2 to 5 times a week. They're half-day programs, and they're primarily therapeutically inclined to teach you techniques, such as the cognitive techniques. If necessary, medication intervention can be provided, and there will be psychiatrists here who can help. The most important thing that you can do, however, is reach out and don't delay. And the first stop should be with your primary care physician. And I think that's the end of my slides, Laura.
Yes, thank you so much, Dr. Minnick. Such important information and resources shared. Thank you so much to all of our presenters, Dr. Smith, Dr. Polanco, for all of the great information. And a big thanks to everybody for joining us this evening. Before we get into question and answer, I want to share a final message that all of the physicians touched on, but it's really important. And we're so glad that you're here with us tonight so that we can extend this message to you and that you can hopefully extend to the people in your networks. And that's that you should never delay the care that you need. We know that many people are afraid to come to the hospital or their doctor's office or urgent care clinics because they're concerned that they're going to get COVID. But as I think Dr. Polanco put it especially well, there's perhaps no safer place than the hospital or a medical facility right now with how serious we're taking this pandemic. There are countless precautions that we've put in place, from requiring all of our care team members to wear a mask and all of our patients to wear a mask at all times, to the frequent cleaning and disinfecting that we do. We are, what I will say, obsessed with everyone's safety during this pandemic. So please don't be concerned that you're going to get COVID if you come in. And don't delay, especially if you have a crisis situation. We've heard anecdotally that some people are not coming in to the emergency room with heart attack symptoms. And that is just really concerning to us because that's a serious emergency that should be attended to immediately and should come into the hospital. An equally serious crisis is a mental health crisis. And as Dr. Polanco was saying, if you are feeling that you need to come in to the ER for the help that you need, please don't delay doing that. If you're interested in learning more about all the ways that we're making SHARP safe to get care, we have put a bunch of information on our website, and that's sharp.com/getcare. After the webinar, you'll be invited to take a short survey. It would help us tremendously if you would be willing to take it. It should pop up right as you click to leave the webinar. We have more of these webinars upcoming. We really wanted to take this opportunity to educate our community, especially our South Bay community, knowing how significantly COVID has impacted our community. And so we want to make sure that we plan our future events with what our treasured community wants to know. We are recording this webinar. I should have mentioned that at the beginning, but we're recording it, and it'll be posted online within the coming days at sharp.com/COVID webinar videos. And lastly, as you've heard mentioned multiple times, if you need a physician, you can visit sharp.com or you can give us a call at 1-800-82-SHARP. I mentioned we have upcoming webinars, and I wanted to make you aware of those in case you or anyone you know is interested in attending. We have some really great webinars coming up. Our next one is about caring for older adults during COVID-19. So we know, we've heard in the news, and Dr. Smith mentioned it, that older individuals are particularly susceptible to COVID-19. We have a wonderful physician. He's the medical director of our Birch Patrick Skilled Nursing Facility here at Sharp Chula Vista, and he's a geriatrician. So he specializes in the care of older adults. And so he's going to have some really great information about how you can take care of the older adults in your lives and what to do if they do become sick with COVID-19. So that's coming up, and we are, like we did with this webinar, we are going to hold that in English and Spanish. And then our final webinar of this series, at least for now, we'll see if there's demand for more topics, which we would certainly be open to presenting on. Our last webinar will be managing your health if you're at increased risk. So I think Dr. Polanco, and I know Dr. Smith mentioned it too, conditions like diabetes and hypertension, we know that individuals living with those conditions are at increased risk for having serious complications from COVID-19. On top of that, if they're not kind of keeping up with their regular care or not coming into the hospital, that can be especially concerning for keeping those conditions under control. So that'll be presented by Dr. Marilyn Norton, who's a hematologist oncologist here at Sharp Chula Vista, and Dr. Stephen Ruff, who's a cardiologist. If you'd like to register for those webinars, you can by going to sharp.com/COVID webinar to register for the English language events, or sharp.com/COVID webinar Espanol to register for the Spanish language events. We're going to begin the Q&A in just a moment. Please feel free to type your questions at any time. You can type them again in the Q&A box, which you should see on your screen. And if you have a question for a specific physician, a reminder to please write that so that we can direct it to the appropriate speaker. And if you could, please keep your questions general so that we have time for all questions.
Or if I may, I wanted to just mention a couple of things that I think that might be important with regards to the emergency room, because as you mentioned, there, you know, throughout the community we've heard that people are worried about getting COVID if they go to the hospital, specifically if they go to the ER because there's COVID. There's people with COVID risk or COVID disease. What I can tell you is, and for safety, what we have done is that the ER is separated with an area where basically we are managing, we're treating patients that have COVID disease. But then we have another section where there are no cases of COVID. So we've done that because obviously we are very concerned. We don't want to be contaminating or putting people at risk of getting this illness. So definitely that's one of the things that we've done in the emergency department or in the ER in all the Sharp facilities. And I can tell you that this is happening throughout all the hospitals. And so I wanted to clarify that part. The second thing that I wanted to mention is that I think it's, again, also important is that if you're traveling, you know, it could be an emergency. You have to go, you know, you have to go somewhere because of whatever the situation might be. We do have, through Sharp as well, we have a section that is called Global Patient Services, which is like Sharp International. So we could be able to be of assistance, especially if something would happen while you travel. We are there to help you and assist you. And this is part of Sharp as well, where we could be able to assist to help you come back to the US if that would be the case, whether it's a medical condition or if it's an injury. And that is part of the Sharp experience that we have and part of the Sharp family. So I just wanted to bring that up because I think it's equally important of the things that we try to do for all our Sharp patients. Thank you.
Thanks for mentioning that, Dr. Smith. And I'm really glad that you mentioned Sharp Global Patient Services. I know I shared that you're the medical director of Sharp Global Patient Services, but I did want to recognize that team and share that these webinars are actually being sponsored, joint sponsorship by Sharp Chula Vista Medical Center and Sharp Global Patient Services. So I want to say a big thank you to Sharp Global Patient Services for joining us and offering this education to the community. So please continue submitting your questions now. Looks like we have one so far, and that question is, can you provide some hotlines for dealing with isolation? Someone to talk to. So Dr. Minnick, perhaps you could take that one.
Sure. The one that we most commonly give is the 1-800 2 sharp number that you've put up several times, I believe. There is a county-funded suicide hotline if the situation requires it. There's also a way of contacting us during normal business hours, and that's to call the cognitive program, which is 1-858-836-8459. And it has a capacity to deal with both our Spanish speaking and our English speaking patients. So there should be no hesitation at all to contact if there's a sense of urgency. If, however, it's at the point where you're having trouble getting through and it's urgent, one of the best things to do is, as Dr. Smith has referred to frequently, is contact the ER. There's always somebody available, and if necessary, the hospital, as you've said before, is the safest place for you to be if you're in fear for your safety or feel that you need to be someplace protected.
Thank you, Dr. Minnick. Our next question is, how about some webinars on what to expect if hospitalized for COVID, if of senior age? You know, I can start with that one. I think that's a wonderful idea, and certainly we can make that part of our upcoming webinar featuring Dr. Daniel Cardinal Castro. But perhaps we can get some comments from one of our experts on COVID among the senior population. Dr. Smith, I know that the ER at Sharp Chula Vista was actually just designated as a geriatric emergency department. Anything that you want to say about the care that we provide for older adults?
Of course, yeah. And part of what we've been working is there are certain things that obviously, yes, we got, like you mentioned, we just got a recognition. But what we've done with that is we are working on making sure that the experience that the care that patients require at a geriatric age, that we learn as physician and nurses to make sure that we're able to take care of them appropriately, whether it's a speech or an auditory, or basically in this case the hearing deficit, as an example. So what we've done is we have several things that we can be able to do to accommodate for those needs. So those are examples, but definitely that is something that we work hard to make sure that we are able to give the right and appropriate treatment. There is another thing that I wanted to mention that just came to light. We are working very hard to open our hospital. And by that, it means that we're working with the local health department as well as the state, that to see when family members are going to be able to visit a patient in the hospital. And I think we're getting closer because we see that that's very important. And as things get safer, I do see that in a very close near future, we should be able to accommodate for a family member to come and visit a patient that it does not have COVID disease. It could be for another condition, but that we work with that part, because I think it's very important for support, and we understand that, and we're working very hard for that as well.
Thank you, Dr. Smith. Our next question looks like it could go to any of our panelists, but I'll start with Dr. Minnick and Dr. Polanco and Dr. Smith if you'd like to add anything. Dr. Minnick, if you've had COVID, are there any long-term mental health effects?
One of the things that we've noticed in our patients, especially in our seniors, is that there's a lingering affective or depressive component. Most of the patients that we admit for the treatment of depression who have been affected by COVID are treated very effectively. But rather than being able to eliminate pardon me, all the depressive symptoms, as is usually the case, we're able to get to the point where there's kind of a lingering what we call a dysphoria, which is a light grade depression. And what we find ourselves doing is continuing treatment on an outpatient setting. The most typical picture that we see in that population, and I mean our patients over 60 years of age, is that they already had a low grade depression, and all of a sudden this comes along to push things over the edge. And again, the ruminative thinking of, well, might as well pack it in. What am I waiting for? What's going on? And either a caretaker, a neighbor, or a relative will refer this individual to us. And if we're not able to treat them on an outpatient basis, they come into the hospital, they feel safe, protected. There are groups, there are other individuals that they're interacting with. We treat medically if necessary, and it gets back to the point where there's hope. They're able to do things, and that's shown to them. And once that's proven, they can either return to their home or they can temporarily go to a skilled nursing facility. And at the same time, we have what's known as a senior intense outpatient program that will provide the service of picking them up at their home or their apartment or their condo and bringing them to the hospital for 2 to 3 hours in the morning, where they take part in didactic programs. In other words, light lectures on the treatment of depression. And then they go into a group process. Then there's a crafts program. Then they go to lunch, and then they're taken back home again. And again, part of the structure and the therapeutic effectiveness of that program has been quite effective. And I hope they'll keep that in mind, because a lot of individuals, especially getting to that age, feel that there isn't any point, and there is. And those are some of the lingering effects that we see that we can treat nevertheless. It just takes a little bit longer now.
Thank you, Dr. Minnick. Dr. Polanco, anything that you might want to add from a primary care physician's perspective?
I would just, really agree with Dr. Minnick, because if it wasn't a condition pre-COVID, it is definitely exacerbated post-COVID. So if somebody had just perhaps a little bit of anxiety post-COVID, it's just highlighted that much more, in addition to the depression. We have seen some patients with a little bit of confusion and delirium, but that's not long standing. That's just, during the infection phase, and that gradually starts to get somewhat better. But as they clear their illness, definitely you see some improvement. So just to add to what Dr. Minnick said, for sure, we see that depression, if it was, if we saw the beginnings of it before, it was definitely highlighted post-COVID.
Great. Thank you, Dr. Polanco. Dr. Polanco, our next question is actually a good one for you as well. Is the lack of socialization in children between other kids of their age, will it have an adverse effect on them psychologically? And if so, what can be done by parents to minimize the effect?
Children are incredibly dynamic and flexible and open. They're like little sponges. And I don't have a research paper in front of me to tell you that, the isolation and the social distancing is having currently an effect on them. But I do know that there are different ways of overcoming some of that, and perception. It's all in the perception, right? I think now children are able to go outside. They're needing to go outside and play a little bit more and be more active. There's certainly opportunities for them to visit with their friends. Before COVID, we were seeing them socialize on these video games and talk to each other, which I thought was, I could hear my daughter talking sometimes. I'm like, who's in the room? And she had a community of kids that she would communicate with. So I say that because they may have adopted some of this technology and created some of these communities way before this COVID pandemic. Now, certainly with school and especially some of the younger kids, you know, they need the social interaction. Of course, they're playing, they're developing some of their stages in life, right? And they're growing. But I do believe that there's ways to overcome it by encouraging them perhaps to taking them out a little bit more for physical activity, and maybe with supervision. I mean, I'm not big on the video games or things like that, but I mean, with supervision, they definitely have a space, just like we're doing right now, where we're doing a webinar trying to reach out to the community. These kids are interacting with each other in a different way that is foreign to us, but it's new to them. And I'm sure it's going to have some sort of effect for them in the future. They will be different. They're, you know, like I tell my children and my patients now, you will have a career that hasn't even been invented. It's so hard for me to try and put you into a particular spot or a box and tell you you're going to be this or you should grow this way, because so many things are changing daily. When, you know, my 11-year-old said she wanted to be a YouTuber, and I said, what is that? And you're going to starve to death. And then she showed me how much the YouTubers made. I said, okay, let's do your YouTube channel. You know, I mean, I didn't do that, but I'm just saying, you know, it's their career, their ideas are just so different, what they're seeing and how they're developing. So I think that flexibility, embracing some of the technology and providing a very safe and supportive household, I think will go a long way in the development of children.
Thank you, Dr. Polanco. I received a couple of questions in advance of the webinar, so I'll ask those right now. Dr. Smith, you talked about Mexico. What special considerations should be taken if we're traveling to Mexico during the pandemic? Did you hear me, Dr. Smith?
Oh, yes. Sorry, I was having a hard time unmuting, but now I'm, I think, can you hear me?
Yes.
Great. Okay. I think if you need to travel to Mexico, it depends on what region. But if it's going to be at the northern border, I can tell you right now the number of cases has improved. So the percentage is smaller. If you go to central Mexico, like Mexico City, the numbers are still, depends on the region where you're going. So again, I think you just have to take those precautions for you to understand and read a little bit of what's going on in that community. The second part is, again, same thing like I mentioned before. You need to wear properly the mask. And there was a question about if the health staff are wearing it appropriately. We work on that to make sure they, you know, the nurses, the doctors, everybody understands how to properly use the in this case, your mask. So definitely that's something that I would recommend you as a member, that you, a person, you go into another country, you wear the mask, social distance, and you wash your hands all the time. So it's nothing different. I think this is something that it's becoming universal. And if you go to another place, you do the same thing. You don't have to do anything different. Avoid crowds. If you know, one of the things that is happening now, more restaurants are opening up. I think, and in essence, you have to choose a place that is open for any type of activity that you're going to be doing. You need to avoid contained spaces.
Thank you, Dr. Smith. We have another question that's for you, Dr. Smith. It was good to hear that there are vaccine trials within San Diego and Sharp. I read today that the CDC was asking the nation's governors to have vaccine distribution sites operational by November 1st. Does that mean that a vaccine may be ready by November?
Excellent question. And short An answer is we don't know. We hope. We are all waiting for a vaccine. If you ask me now, what I envision is, yes, it's getting closer and closer. There are different trials of different companies that are doing vaccines, and we're just trying to figure out which one is going to be the best one. And then once we go through that part, then it's the massive production of the vaccines. Then the other part is going to be working on giving it to the community. So I would probably say we're still a little bit far away, but it's definitely getting closer and closer. But it's going to be a process that it's going to take for us to, once the vaccine is, the proper vaccine is found, then it's going to be again the vaccination process in the community.
I would just add to that, Laura, that as we look towards the coronavirus vaccine, let's not forget to get our flu vaccine. We're going to be entering our flu season, and the biggest risk is to have the flu on top of COVID or vice versa. So, let's all try to get our flu vaccines on time. They're already available in some places, and I know that we are encouraging our seniors to get it, towards the latter part of September, early October, so that it's, as strong as can be throughout the flu season. But we definitely don't want to keep looking towards the COVID vaccine and forget that, that one is just so important in addition to our pneumonia vaccine for our seniors.
Correct. And the zoster vaccine too. So there's several that are available that are very effective. Now that I think we're putting more attention of vaccines, you are right, Leticia. It's very important for the community and the people to be aware to not forget the other vaccines.
Very important. Thank you both. We have a final question that looks like it's also a good one for Dr. Smith, and that's, you didn't mention dexamethasone. Is this corticosteroid still used, or has it fallen out of the treatment drug list?
Okay, excellent question. We are learning how to deal with this virus. There's still a lot of unknowns. And I can tell you that as more as we learn, we realize that it's not a virus that is just attacking the lungs, for example. We've seen it that it reacts in different organs and in different ways on people. And one person can get the virus in one way, and another person can get it in a different form, meaning that it will maybe be more prominent in the heart or the blood system. So with different treatments or modalities, like I mentioned before, remdesivir or hydroxychloroquine, the same thing with dexamethasone. It came out, it was started to be used just because we needed something to use in our patients to see if it would work. Now that we've been establishing treatments with this medication, it's a steroid. That's all it is. It's a specific steroid. We've learned that maybe it will work on the early phase of the illness. Now, what's happening is now that we've gained experience, there are more studies that are coming out where they're going back to see these patients to see if it really helped. The early trials are demonstrating that it's not making a difference. And actually, that maybe it could be a little bit of a risk. Same thing, that's what happened with hydroxychloroquine. So what I'm trying to tell the community is we are learning about this virus, and I think there's still a lot more to learn.
Thank you, Dr. Smith. We have another question. How many days is appropriate to take the FAST test for COVID after presenting symptoms? And is it a reliable test to discard COVID? Looks like some physicians in Mexico do. Dr. Smith, is that something that you can comment on?
The fast test, like is it the PCR is that the question? And
Uh,
if,
yeah, the
or is
person
it the
didn't say.
antigen test? Maybe because that's something that has been brought back in the past.
Yeah,
Maybe
not clear.
okay, and maybe I'll answer a little bit. And Leticia and Dr. Medic, if you want to pitch in, but I can tell you that, for example, we're doing, and basically pretty much all over the world, is that we're doing which is the PCR. And basically it's the nasal, and it's coming now that it's going to be more of a maybe even like a oral test now. But in essence, basically that's the test that we have that is mostly reliable if we do it properly. And I can tell you that yes, it has a good sensitivity. Again, if we do it well, it could be up to about 85 to 90%. If we don't perform it well when we're doing the testing, in other words, we don't put it in the nose properly, then the test can fall down to about 70%. Okay, and that's with a nasal PCR that we have right now. The antigen antibody testing that we hear in the community that is being done, like in Mexico or other countries, and even within the US, that's a big unknown. And basically what the thought behind it is that you're measuring antibodies, meaning that basically the IgG or the IgM or the IgG, and your immune system is able to pick it up, meaning that maybe you got in other words, you were infected and your body's producing antibodies. It makes sense. But unfortunately, when we look at these tests, they're not very reliable. And I can tell you, for example, in myself, it happened to me that I was tested with one of these antibody tests. The first one said that it was positive, meaning that I was exposed and I got infected and now I had antibodies. 2 weeks later, I was tested again and it was negative. And we've seen that. So that unfortunately is a test that is somehow, at the moment, it's not very reliable and we just don't know that much about it.
Thank you, Dr. Smith. That was our final question. So I want to say a big thank you to all of our physicians, Dr. Andres Smith, Dr. Leticia Polanco, Dr. Joseph Minnick for the excellent information and spending their evening with us tonight. I did mention that we held this webinar in Spanish last week, and these three physicians presented again in Spanish. So a special thank you for doing this twice and educating our community. Also want to again thank our co-host of this webinar this evening, which was Sharp Global Patient Services, and you can't see him on the screen, but behind the scenes, Hugo Barranco Garcia has been integral in planning these webinars and a great support to all of us in putting this on. So I want to say a big thank you to him. And of course, a thank you to all of you at home or wherever you are for taking the time to invest in your health and learn about this topic and hoping that you pay it forward and share it with others. A reminder, I put this back up on the screen about our upcoming webinars. We'd love to have you at those, so please register. They are free, like this one was. And a reminder that when you leave the webinar in just a moment, you'll be presented with a short survey. We would so appreciate you taking that. And just a final request that you take care of yourselves, take care of the people in your lives, be kind to yourselves, and hang in there. We will get through this. Thank you so much for joining us this evening. Did want to say if you have any final questions, I sent an email to most of you who are registered earlier today with a final reminder about the login. If you have any questions, feel free to send those to me, and I think our physicians would be happy to answer those after the fact. Thank you again, and good night.